this is just a recognition of the crucial role that the private sector plays in ensuring that Kenyans are healthy. And so to this effect, we've had a long relationship. Our relationship stems all the way back from the beginning of this fund being set up, NHIF. And we've been able to engage and ensure that Kenyans access services. We've been able to review the different benefit packages within this institution, NHIF, and expand service coverage for Kenyans. Today, we've had a deliberation, particularly that is nested on ensuring that service continuity continues, and more importantly, that as we work together as partners, we ensure that services are affordable for the Kenyan. Part of our discussions today have touched on how do we ensure we have seamless, continuous engagement with the private sector. How do we have a review process that looks at the different prices and payments for different packages that we have on offer? But most importantly, the biggest point of discussion today is how do we ensure services continue undisrupted? That we've reached an agreement, there shall be no halting of services at the private sector. We have given ourselves a moratorium period where we shall be able to review the current payment rates. We shall be able to come together around the table and discuss how we ensure care is affordable while ensuring the sustainability of both the private sector and ensuring that you as mwananchi are also able to access services. But for now, it is to allay any fears that if you go to a private facility, you will not receive services. That fear should be completely allayed. There shall be no halting of services by the private sector, and we shall continue working together, hand in hand, collaborating towards ensuring you are able to access services and that we're able to walk towards this journey of universal health coverage for the country.
NHIF made a unilateral decision without consulting the service providers and the public sector in putting up the ribbons. And one thing that caused is that there was a lot of uproar and outcry from different stakeholders. One thing that indicates is that generally the government is using NHIF to run the UHC. And we believe that, as you see, it's not really possible that the UHC can only be run by NHIF. There's need for government to invest more funds in healthcare. I think that's really what is causing the issue and what's causing the problem. So ideally, for the UHC to work, there's need to have more funds in the public sector and there's more funds in healthcare in general, because that will ensure that service provision is actually enhanced. But if the government is running the UHC only with the contributions that the public are doing to in NHIF, then I believe we will not be able to have a sustainable service provision as expected.
Transplant bill to be expedited so that we expand the donor pool in the country. Currently, only donations are only allowed between family members, or what we call living-related donors, and we think if we can expand this pool so that we can have more people, including deceased donors and non-related donors, there will be a bigger place where we can look for donated kidneys, and there will be more people who will be able to access transplants and leave dialysis, which, like we have said, is quite expensive.